in 4 people with diabetes, one of them doesn't know that has it until this person gets ketoacidosis. When the patient is unconscious and nobody knows what is happening. But as a clinician, after verifying the signs, you know that this one has what? Has diabetes. You get it? So I say we have 2 types of diabetes. Diabetes mellitus. One, two types of diabetes. We have type 1 and type 2. Type 1 is called juvenile. And type 2, in fact, this one is insulin dependent. Then this one is called non-insulin dependent. This type of diabetes is in adults, but this one is common in what? In children. Then we have another diabetes, which is the accident-induced, pregnancy-induced. You get an accident and you get diabetes. You get? Yes? How? Now, these people who have got accident, and you must eat very well. You get? You make sure you eat very fast. And they consume everything. And remember, they are like on a bed with legs up. You get? Is not doing any exercise, and you find is accumulating a lot of carbohydrates and is not using them. So pregnancy, this one is in the pregnancy. These women who become pregnant and they are big.
Excuse me, sir, question.
And children with diabetes, this type 1, they don't usually survive. Because by the time the mother or the parents take the child to the hospital, they always take them when they are unconscious and they have got damages to kidney, liver, heart, the brain, get, and they don't survive. But this other type of diabetes, type 2, there is some changes, and you are in the hospital, and if you land on a good clinician, will diagnose that you have diabetes and you start treating it. You get it? But now let us go to what? To size. The random blood sugar, normal random blood sugar is 3.5 to 6.4 millimoles per liter. Or 75 to 119 milligrams per deciliter. But this, they usually take this because most of the glucometers in hospitals, they take it, they measure it in what? In millimoles. So that is the normal range.
Excuse me, sir, another question.
May be producing insulin, but it's not enough. You get it? It's not enough to activate all the cells in the body to take up glucose. But in type 1, there is total loss of insulin. Insulin is not produced at all. they are lacking insulin. They don't have any insulin in their body. And when they take food, especially carbohydrates, the glucose doesn't cross to the cells to provide energy. And most of the time you find, because the energy we get from the food is in the form of ATP. ATP is the energy that is used to do most of the functions. Absorption. Most of the foods we eat, they need energy to be absorbed. Active transport. You study those things when you study physiology. And then another thing, because getting energy and it starts depleting the fats, the lipids, and the proteins. And when proteins are depleted, they die. You get? So body prominence, the adipose tissue is broken down to release energy to support the other physiological activities. You get it? And they end up losing the adipose tissue and they become smaller. What you see here is just, don't think it is muscle, because I don't do the workout. I want to start and reduce the fat and build up the muscle. So what you have under the skin is what? Is fat. Under the skin